Welcome back to the Psychoanalysis Course Studies in Hysteria Part 2 of the Preliminary Communication. In the first discussion so far, we looked around how Freud and other fellows had together worked in understanding the hysteria and actually had worked upon many other mental disorders, which are the basis for today's understanding of DSM. So in the discussion, we were somewhere discussing about the two core roots of Genesis. Some mention of the two core roots of Genesis of a hysterical complex. So we were just unpacking it. So can we take it further?
Uh, it's very interesting. Freud mentions there two core elements in generation of traumatic hysteria.
Right.
The first one has to do with the strength of the trauma. And this again subdivides into two. That an event happens in which somebody does something, the result of which is high amount of traumatic feeling, which cannot be expressed and therefore is bottled up in some way, becomes the nucleus of a difficulty later on. And here, the second component is maybe there is a fantasy which generates so much of feeling that it cannot be expressed because of reality, morality, and bottles up and becomes a nucleus of a difficulty. So the first category is intense generation of traumatic affect. And this is subdivided into two, because of something outside or because of a fantasy inside. This is the first root which is very important for development of traumatic hysteria. Second part actually is very interesting, which Freud did not explore further later. And that is, Freud says, the psychological state in which the person was when these events happened. Let it be the event outside or the event inside. Let it be an event in reality outside or an event in fantasy inside. But when this causal event happens, what is the psychological state in which the person is? And this gives rise to the idea of high susceptibility states and low susceptibility states. That it is quite possible, according to this idea, that the event may not have such strength so as to precipitate a trauma, but the state in which the person was, that state predisposes the person to creation of a trauma. And some of these states can be the states of twilight states, a states of high sensitivity, a state of being already baffled by too many things and already on the edge. So this creates the idea of the background effect, which what I call as background effect. That what is the state in which an event is received? It is as important as the event itself. Often we see similar events happen, and in one case we feel very traumatized, very thrashed, and the others we just walk aside without being bothered about it. Because the background effect is different, that 5 events before that event were of a particular type, leading us into a particular state. 5 days before such events have happened, that we are in a more happy, robust state. And let us say 5 days of tragedy, and we are already into a vulnerable state. And the same event, which would not have broken us, now breaks us. We see this accumulation, this background effect very clearly in depression. That what used to be a normal event now becomes irritable. So, very interestingly, Freud talks about the psychological state in which this traumatic event happened, or rather an event happens which precipitates trauma. Now, the second component Freud did not explore in details, and the reason is very simple, that this would take us into elemental modeling of the system which leads to creation of a state. Because once you say a state, Then the natural question is, how is the state created? What are the elemental, structural, and functional components which lead to creation of a state? And that would have taken Freud into an area which was too early, which is even too early today. The conceptualization of mind in elemental terms, structurally and functionally. And this obviously at that point was almost an impossibility. It's near impossible even today, but not impossible. I would say just difficult. So this is very important, that the two components that Freud thought were important in creating hysterical trauma was, one, the strength of the traumatic event itself, either outside or inside, and second, the state in which this happens. And the state in which the precipitating event happens, that has been abandoned, I think, largely by everybody. That nobody talks about the state in which the event happened and what led to the creation of that state, and in general, how is a state created. So that will take
I
us
think most of the
into
therapists do.
huh?
Most of the therapists do talk about this on the whenever there's a traumatic event. What was the age? What were the other important factors around? It's not in the light of
They
this
talk about
probably, but
no, they talk about the context of the state of the traumatic event, but they
no,
look,
the psychological state as well.
very few of them will do actually, because
I think in-depth investigation would investigators would definitely look into it.
very few of them, in the sense that I am referring to, because it will lead to, let us say, one can go to a general description of the state, that were you vulnerable, were you in the best of your elements, what state you were in when this happened. This would be the line of inquiry. But let us say I go deeper, that somebody says that this happened when I was vulnerable. And the next question will be, if the person was not vulnerable, would that event have turned traumatic, or would it have been like any other event? Because this will bring out the contribution of the state to creation of trauma. Now that is a very difficult question to answer. Even more difficult question to answer will be, how was that state created in the first place? Now a general description can be, I was facing through a tough time, ABC had happened, and therefore I was in this state. Till this macro part one can do. But if one is going to theorize in terms of elementals, then we get into the deeper part of the chakra theory and the life energy. That how
All right.
it created in the first place.
Right.
Because that elemental kind of thing is very difficult to do. So one
Right.
is, people actually go into the contribution and the significance of the state in which an event turns into a most of
Right.
the times it is the strength of the event which is held responsible for the event converting into a traumatic event. So this is where the Freudian original idea was, which later was dropped not only by Freud, but practically by all psychoanalysts. So whether we look at Jung, or we look at Winnicott or Kohut or Klein or even ISTDP, the strength of the trauma is well respected, but the contribution of the state, we can have words for it: sensitivity, fragility, vulnerability, lack of resilience, lack of a healthy self. We may have indirect words for it, but we
Especially in the childhood stages, we have also seen there is a need of attention. There is a need of uh, the need of having a stable object. Many of the traumas, especially the sexual abuse, they have these backgrounds prior where they are people who have a certain state because of which they get into the guilt because of the unconscious link between of what they wanted and how it occurred.
Right. In fact, this is very important because the background effect of accumulation is what actually leads to cascading of trauma. Say, for example, you have a difficult first 2 years of life and you go into the Oedipus already traumatized. So it's very difficult to negotiate successfully the Oedipus because the pre-Oedipal pathology predisposes you to an Oedipal pathology. And the Oedipal pathology later predisposes you to difficulties of outside world, the society, and that in turn leads to another series of trauma. So what we see there is
like Oedipus being inevitable in most of the cases becomes a background to it, definitely. But there are other small t's which a person, somehow become a magnetic force to attract the big T. Not here to blame the person, but in a way where he's unfolding it the the big T, not in the term of where he's sexually abused or gaslighted, but somewhere like I'm not getting the right word. For example, there is a child who has authority figure issues, and now he's afraid of teacher. Now, in unknowingly, and unconsciously, his behavior would align for more of the reaction from the authority figures, and that is how, because that is the known part, and then the big T occurs. So somewhere there is always a background to it, and it is considered in depth.
I would differentiate here between the state that Freud is referring to and trauma causing susceptibility to subsequent trauma.
Right.
One trauma creating a predisposition for the next trauma. That is one thing. What Freud is referring to is a state in which a person is. Now, let us say if we were to describe a state, we will have to say what constitutes a state. So we will have to say that total of consciously felt thoughts and feelings, they constitute a state. And maybe that state also has resilience or absence of it built into it. So if I say, how do I describe my state at this moment? I will have to say that I feel healthy, I feel involved in a conversation, I feel the active centers in me are the analytical component, recollecting the Freudian theory, as well as a slight pressure of time to finish this in the given time, and some sort of a resilience and a necessity to argue out my point. That would be the definition of a state. Emotionally speaking, am I vulnerable to trauma at this point? I may not be so much. If I was coming after 5 days of a very stressful schedule, already traumatic person. So when we describe a state, that state that Freud is referring to of, let us say, this state that he is referring to in a specific way, he is referring to in two ways. One, the state in which the first trauma happens, or the state later on such that the prior traumas are deactivated and the person is in a state which is resilient to or open to new traumas. This is the type of thing that he refers to. Obviously, once a trauma happens, the second state is difficult to actually have. And all subsequent states will, by and large, whenever the vulnerability is there, a part of the vulnerability will be contributed by the prior trauma. So this is very important what Freud is referring to of a state where probably if we go into it in an elemental way, we will be looking at a dynamic idea of resilience. That how much of the state contributes to making an event traumatic and how much is the inevitability of the strength of the event itself that it converts itself into a traumatic event. So that too, in which the second component is usually not looked at least in the first trauma. And otherwise also I would say the cascading effect of trauma that itself is looked upon by 25-30% of people. And there, the cascading event, it's difficult to link up also. It's not easy. For example, let us say,
Is he, to make it little easy with the current, because this is totally a preliminary communication-based thing, is it actually what he's referring to, the ego strength prior the trauma?
yes, I think it's a good phrasing of it. That is how it would be. That if we were to capture everything of that state into one word, it would be ego strength. It's ego strength prior to the first trauma. That is what operationally he means by bringing the concept of the state in the formation of traumatic hysteria.
Formation. You were giving some examples, sir?
He gives an example of a case where the girl is sitting on a chair. It's a twilight time, and one of the girl's arms is hanging by the chair. As the blood flow is impeded, no sensations are felt here. And then later on something happens and some part of the body does not feel the sensations anymore. There is a kind of hysterical anesthesia or hysterical paralysis kind of thing. And then it traces back in case analysis of how that state actually contributed to creation of later hysteria.
All right, sir. Now it's quite clear.
So that is the kind of state he has in mind, is that kind of a thing, that the state in which one is.
So it's a prerequisite to the trauma. Some memory.
Yeah, because in certain cases that decides, the state is very important. It is not only the event which would inevitably have made itself traumatic. The state has a contributory role to play, which later on got on the sidelines, the whole idea of the state, because the state idea will inevitably lead to the idea of creation of the state and therefore a elemental modeling of the mind, which was very far at that point. That was one. And second, the contribution of the state, at least in the first traumatic event, will either lead to that modeling thing or it will lead to another unknown called the constitution. And then you'll be substituting one unknown by another. So most of the people at that time, they actually went on one side of the strength of the event till almost Kohut, where we see the healthy self as being the core, and in a way you are trying to get into a preventive mode in one sense. So that component
basically in the Kleinian way, before this, basically in the Kleinian world, it is before the split occurred. In the healing space, we are taking them into a depressive position, even before the split existed.
Let me correct myself. I think even before Kohut, in Klein, you see that thing of building up one's strength in terms of their insistence upon the internalization of good, reliable, stable object.
Okay.
That tends to be corrected. That Klein did talk about the good, reliable, stable objects internalization as the core to psychological health, and that will led to less and less of those states where vulnerability is high.
Mm.
And it will lead
Right.
to states where the resilience is more, and less of the external
Mm.
events can become traumatic.
Right. So, how does this preliminary communication set the stage for later healing approach? As we just initiated this conversation of healing approach towards it and the frame of psychoanalysis.
The preliminary communication actually sets it's like the first white paper of theory, and it is followed by case studies, especially 5 of them very popular. And then it's again followed by a theoretical summing up. And after this studies in hysteria, we see by and large Freud coming onto his own, which partly he starts there. So later on we find Freud lecturing on his own. And we see the
Mm.
emergence of independent Freud post studies on hysteria. And we also see this sets the stage very importantly for uh, going back to childhood, which is still not begun. And therefore, Freud makes a very important remark in this that, in fact, both of them make this collectively, Brewer and Freud, that we have been able in many cases to relieve the patient of his symptoms, hysterical symptoms, by using our new method. But we cannot guarantee the non-recurrence of those symptoms. And that is because
Acha.
they are still not going into the childhood,
Mm.
still not into the Oedipus, because the concept of Oedipus is yet not there in the theory. The psychosexual stage is
Oh.
not there in the theory. So they are still dealing
Oh.
with adult patients, and they are still dealing with here and now. They are not essentially going back to childhood, and therefore they are not able
There's
to.
no regression here.
There is no induced regression, so to say. That there will be a spontaneous regression in the patient, but no induced regression by the
Mm.
frame of psychotherapy. Because the
Okay.
method is still not in place. The frame of psychoanalysis is still not.
Mm. Mm.
The couch, the 5 days a week, the frame, the anonymity, the blank skin, nothing is in place. All of that will come
Ah.
later. They're still fumbling with the initial components. And therefore, they are yet to go into the childhood. They are yet to find the sexual repression as a center of much of it. And they are yet to create the frame and the space of psychoanalysis, so to say. But apart from that, all the fundamental concepts are in the preliminary communication. What is not there are the
Mm.
component instincts. What is not there is the death instinct. What is not there is the model of the mind. What is not there is a superego pathology. What is not there is the frame of psychoanalysis, the way to conduct therapy. All those are not there. What is not there is the two-force model of not only Eros and Thanatos later on, but even the earlier two-force model of pleasure and aggression.
Oh.
All of that is not there. But it sets the
Okay.
stage for all of it.
Right.
It is just one step away from the idea of the unconscious. It is one step away from the idea of cathexis and catharsis, one step away from ego defenses, and one step away from going to the childhood and finding the repressed erotic complexes there. So in that sense, there are certain parts of later theory which are there, certain parts which are not there, but it sets the stage for Freud to be independent and then to take developmental steps of theory,
Mm.
which later on get into what is called the introductory lectures to psychoanalysis that Freud independent.
I think is it even before the model of mind also?
Yeah, it's even before the model of the mind. Neither of the two models, topographical or structural, neither of them are still there. And the concept of id-ego, superego also are not there. If you
Oh,
if you see this writing, preliminary communication, there is no use of the word id-ego or superego, because this is still pre to those concepts. They are fumbling with what they have in front of them, trying to make sense out of it, trying to create a new method, trying to generate new concepts. So it is still pre to all of that that you take for granted in Freud. But it sets the stage for Freud to be independent, and it sets the stage for the later theoretical work, and then the frame of psychoanalysis eventually. So it is like a, a, a moment pre to the moment of creation, that kind of situation. But preliminary
he's in that state of PT, like PC, prior the creativity took place. This
prior
is
to
the grounds. Yeah.
so in that sense, the ground is being cleared for the airport to develop and the flight to take off.
Amazing. Freud is deep and demands contemplation. In the coming episodes, we will take up the sequential part of studies in hysteria, which is case studies in hysteria. See you all again. Namaste.